Can you believe it? At just 25 years old, she already has to undergo dialysis 3 times a week. The doctor said that if it had been detected earlier and her lifestyle had changed, her kidneys could have been saved. A truly alarming statistic. In Vietnam today, out of every 10 dialysis patients, at least 2 are under 35. Kidney failure is no longer an illness of the elderly, it's quietly creeping into younger generations. Slowly but very surely. Why is kidney failure becoming more common among young people? And how can we protect this vital life filter starting today? In this video, I'll help you understand the causes and share the 5 most important habits to prevent kidney disease. Before we begin, don't forget to subscribe to the Live Healthy Everyday channel and turn on the notification bell so you won't miss any of our upcoming health videos. And if you've ever taken medication, used certain foods, or have habits mentioned in today's list, or if you're wondering about kidney health, diet, or warning signs, please share your questions in the comments below. I'll do my best to read and reply. So together, day by day, we can keep our health strong and lasting. Now, let's dive into today's main topic. My dear friends, let's start by understanding the life filter inside our bodies, our kidneys. The kidneys are an incredibly sophisticated filtration system that works around the clock. Every single day, those 2 small organs filter more than 170 liters of blood to remove toxins, balance fluids and electrolytes, and help regulate blood pressure. Yet most of us rarely think about them, until our bodies begin to send warning signals. When the kidneys weaken, waste and toxins start to build up in the blood. That's when you might notice subtle but important signs: fatigue, poor appetite, restless sleep, dull skin, slight puffiness in the face, heavy limbs, reduced urination, or urine with an unusual smell. Some people wake up with swollen eyelids, or find that their shoes feel tighter in the afternoon. All these are early indicators that your kidneys may be struggling. The worrying part is that in young people, these symptoms are often ignored or mistaken for work fatigue, sleeplessness, or stress. I've met several young adults, only 28 or 30 years old, who came to the clinic with kidneys already more than halfway damaged, still believing their exhaustion was simply due to lack of sleep. According to Vietnam's Ministry of Health, tens of thousands of new kidney failure cases are reported each year. And the number of patients under 40 is rising rapidly. In major cities, for every 10 dialysis patients, 2 to 3 are very young. That's a truly alarming statistic. Nephrology specialists explain that the reason kidney disease is affecting younger and younger people mainly stems from modern lifestyles. We eat too much salt, drink too little water, hold in urine, overuse painkillers, and live under constant stress. All these factors combine, forcing the kidneys to work overtime for years on end. Young bodies tend to adapt well, so symptoms may not appear right away, but that silence is dangerous. By the time you start feeling tired, swollen, or notice reduced urination, your kidneys may already be significantly damaged. What I want to emphasize is that kidneys don't cry out in pain, they quietly weaken day by day. And when your body finally speaks up, it's often too late. That's why recognizing early warning signs is crucial. If you often feel fatigued even after resting, notice puffy eyes in the morning, or see your urine getting darker for a long period, don't ignore it. It may be your body's gentle way of saying, please, take care of your kidneys. Now, let's take a closer look at why kidney health is deteriorating so quickly among young people, and the most common causes behind this growing problem. The first cause comes from unhealthy lifestyle and eating habits. Many young people love salty foods, fried dishes, processed meals, soft drinks, and strong coffee. These foods are loaded with salt, sugar, and saturated fats, forcing the kidneys to constantly work to filter them out. Over time, the blood vessels inside the kidneys narrow, leading to high blood pressure and decreased filtration capacity. On top of that, drinking too little water and holding in urine make the urine more concentrated, which easily leads to kidney stones and infections. Each tiny stone is like a scratch on the kidney tissue, and over time, those scratches add up to serious damage. Don't assume youth means immunity. Kidneys can't withstand that abuse forever. The second cause is the overuse of medication. Many people, when they have a headache, muscle pain, or the flu, buy and take painkillers or anti-inflammatory drugs repeatedly without consulting a doctor. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, when used long-term, can damage the kidney's filtering cells. Some so-called supplements, herbal medicines, or unverified functional foods also contain heavy metals, forcing the kidneys to overfilter and overload. I've met many people who believe that taking supplements was beneficial, but the kidneys can't tell the difference. The more they have to filter, the more exhausted they become. The third cause is the increasing rate of obesity, hypertension, and diabetes among the young. In the past, these conditions mostly affected middle-aged adults. But now, many people in their early 20s are already diagnosed with type 2 diabetes or high blood pressure. When blood sugar or blood pressure stays high for too long, the small blood vessels in the kidneys get damaged, reducing their ability to purify the blood. At first, there are no obvious symptoms, but after just a few years, the body becomes fatigued and swollen, forcing lifelong treatment. Diseases once considered part of old age are now becoming illnesses of the young, all because of sedentary lifestyles, high sugar intake, and chronic sleep deprivation. The fourth cause is kidney or urinary tract disorders. Some people are born with structural abnormalities in the kidneys or ureters, such as vesicoureteral reflux or urinary tract narrowing, which cause urine to back up and increase pressure on the kidneys. In addition, conditions like glomerulonephritis, nephrotic syndrome, or long-standing kidney stones, if not properly treated, can lead to kidney tissue scarring and loss of function. Many people experience mild burning when urinating and assume it's just a minor infection. But over time, that can progress to acute kidney failure. Lastly, there are acute risks that can cause sudden kidney injury. When the body becomes dehydrated due to high fever, diarrhea, or severe infection, blood flow to the kidneys decreases, leading to oxygen deprivation and gradual cell death. Exposure to toxic chemicals, contrast dye used in X-rays, or severe trauma can also trigger acute kidney failure. If not managed promptly, such damage can leave permanent, chronic complications. As you can see, most causes stem from our own lifestyle habits. Kidneys don't cry out in pain. They quietly endure until they can no longer function. By then, even the best medicine or most advanced dialysis machines can only maintain life, not restore full health. Don't assume youth is a shield. Health doesn't wait for age. And neither do your kidneys. If we learn to make changes early and truly listen to our bodies, most risks can be prevented. Now, I'd like to share *5 essential habits to protect your kidneys and maintain long-term health, starting today. The first habit. Get regular health checkups and monitor kidney function. Kidney disease is hard to detect early because it doesn't cause pain, fever, or immediate discomfort, but just one simple blood test to measure creatinine levels, and a urine test to check for protein, can reveal how well your kidneys are functioning. You should do these tests at least once every 6 months, especially if you have high blood pressure, diabetes, or a family history of kidney disease. Early detection makes treatment much easier and prevents progression. In many cases, timely checkups combined with proper diet and lifestyle adjustments can restore kidney function. I always say, prevention is easier than cure, and once the kidneys are damaged, it's very difficult to bring them back to their original state. The second habit. Eat a balanced, Kidney-friendly diet. Reduce salt, protein, and sugar. A well-balanced diet is the greatest gift you can give your kidneys. They are extremely sensitive to sodium, protein, and sugar. When you eat too much salt, your body retains water to dilute the excess, which raises blood pressure and forces the kidneys to work harder to eliminate it. Consuming too much protein, especially animal protein, produces nitrogenous waste, which adds even more strain on the kidneys. When you consume too much sugar, your body can develop insulin resistance, which leads to diabetes, one of the leading causes of chronic kidney failure. That's why in every meal, simply cutting back on salt, choosing fresh foods, eating more vegetables and fruits, and avoiding fast food, canned meals, and sugary sodas can already give your kidneys a well-deserved rest. Just reducing 1 teaspoon of salt a day can mean years of stronger, healthier kidneys. It's truly worth it. The third habit. Drink enough water and never hold in urine. Water is the kidney's best friend. When you drink enough, your urine helps flush out toxins, salt residues, and bacteria from the body, lowering the risk of kidney stones and infections. The ideal water intake is about 1.5 to 2 liters per day. Depending on your weight and activity level, sip water throughout the day rather than all at once, especially not before bedtime, to avoid swelling or nighttime urination. And most importantly, never hold in your urine. When you do, bacteria have more time to multiply in the bladder, which can travel upward and infect the kidneys. Even one instance of holding urine may seem harmless, but repeated over time, it can severely affect kidney health. So, make drinking enough water and urinating regularly the simplest daily acts of love for your kidneys. The fourth habit. Avoid overusing medication and stimulants. Your kidneys are responsible for filtering and excreting most of the drugs you take. That means every pill you swallow adds extra work for your kidneys. Many people habitually take painkillers, cold medicine, or unverified herbal remedies, not realizing these substances can damage kidney cells when used too often. It's best to take medication only when truly necessary and always follow your doctor's instructions. In addition, alcohol, cigarettes, and strong coffee constrict blood vessels, depriving the kidneys of oxygen and reducing their filtering ability. I've met many young people who think drinking alcohol for social occasions is harmless, but after just a few years, the alcohol has already severely weakened their kidney function. The kidneys never say, enough, they simply endure in silence until they can't anymore. And finally, the fifth habit. Stay active. Maintain a healthy weight, and control your blood pressure and blood sugar. An active body is a healthy body. Regular exercise improves blood circulation, reduces pressure on the kidneys, nourishes blood vessels, and enhances filtration efficiency. Just a 30-minute brisk walk a day, choosing stairs instead of elevators, or doing a few gentle morning stretches can make your kidneys' job much easier. Along with that, maintaining a healthy weight, eating well, getting enough sleep, and reducing stress help stabilize both blood pressure and blood sugar, 2 key factors that directly determine kidney health. Experts often remind us that keeping blood pressure under control can cut the risk of kidney failure by half. And stable blood sugar protects the tiny blood vessels inside the kidneys from damage. These 5 habits may sound simple, but they form the foundation of lifelong health. The kidneys don't need grand gestures, just a little daily care, 1 less pill, 1 extra glass of water, a bit less salt, a few more steps. Don't wait for warning signs to start taking care. Once the kidneys are damaged, they can't regenerate. My dear friends, the kidneys are like a silent companion, never complaining, never demanding, yet carrying the lifelong responsibility of cleansing your entire body. Once that friend grows weak, every other organ feels the consequence. True health isn't something distant, it's found in every glass of water you drink, every meal you choose mindfully, and every night of restful sleep you allow yourself. Don't wait until exhaustion, swelling, or sleepless nights push you to a doctor's office. By then, your kidneys have already been struggling for too long. I truly believe that if we listen to our bodies a little earlier and make small, consistent changes every day, not only will our kidneys stay healthy, but our heart, liver, lungs, and mind will thrive too. Life isn't about living the longest, it's about living well, living gently, in a body that is grateful and cared for with love. You see, taking care of your kidneys is really taking care of yourself. So today, after hearing these reminders, start with one small action: drink an extra glass of water, eat a little less salt, or stand up and move for a few minutes. These simple acts are priceless medicine. No pharmacy can sell them. If you found this video helpful, don't forget to subscribe, turn on the notification bell, and share your thoughts or questions in the comments below. I'll read every message and continue walking beside you, day by day, on this journey to live healthy, live peacefully, and live in harmony with your body. See you again in the next video.